Here at MCRH, we have a surgical complex, which we have secured 200 million so that once completed, we shall have a 65-bed capacity for maternal and child complex. And also we shall ensure that we have piped oxygen both at MCRH and also at Awendo, which is going to cost us about 16 million. And at MCRH, we have also a regional cancer complex. And this cancer complex is going to help our people for diagnosis and for care, medical care, and at the same time, we offer treatment to the people. And we are also planning a modern maternity wing in Rongo, Nyamaraga, Kehancha, and also Makalda, so that services can be brought closer to our people. Not only that, we have done a lot of infrastructural improvements in our level 2 and 3 facilities across the county, and even planning to upgrade some of these facilities, more especially from dispensaries, which are level 2, to level 3, which are health centers. And this is a vision which would be done, and it is spread across all our sub-counties within Migori County. And budget lines have been made so that this one can be accomplished. We also have a vision as a county in regards to infrastructural development. For example, Migori County, we have a vision of grouping it into 5 zones so that we can have high-level facilities. For example, we have the Migori County Referral Hospital where we are today, and we have a vision of upgrading it to a level 5 facility, and it will be like a regional hub. Then, as you are aware, we have the Sona East and Sona West. In Nyamaraga Hospital, we intend to upgrade it so that it can serve the western part of Sona. And then in the Sugar Belt, we will upgrade Awendo Sub-County Hospital as another referral facility to serve the Sugar Belt. And then Makalda Sub-County Hospital, we shall upgrade it and improve its infrastructural facilities so that it can serve the the lakeside zone. And then we have also the Korea zone, which we are intending to upgrade Kehancha Sub-County Hospital to serve the building block, which His Excellency the Governor has a vision to improve the health sector, is on health products and commodities. And I want to say that at MCRH here, we have delivered medical equipment worth 50 million, so that we can ensure that our referral systems are well equipped. And then we have also launched the Migori County Health Products Supply Chain Strategic Plan 2024 up to 2030. And I want to say that this one is going to cut across in all our facilities, which I've already mentioned. And we have also received a donation of health products to dispensaries and health centers led by the Luala Community Alliance to the tune of 15 million. And if you go to our facilities, level 2 and 3 facilities, there are commodities there, which is going to serve us for a longer period of time, courtesy of Luala Community Alliance. At the same time, we have also reduced our stock out of essential medicines and medical supplies by ensuring that we have timely procurement and also distribution. And we have also developed a policy whereby through FIF, we are able to retain 30% in our facilities so that essential commodities are bought across board for our level 2 to level 4 facilities to ensure that there are no stockouts. And at the same time, we are looking ahead to raise annual funding for commodities at a tune of 320 million so that we can complete our warehouse at MCRH, which is just behind us, so that we can strengthen accountability in supply management. In regards to healthcare information, I want to say that as a county, we are gearing towards digitalization of all our health facilities. And in this regard, We have distributed 529 tablets to digitize our public health facilities, and this involved a number of activities. For example, we did a basement assessment survey, which showed gaps. We have done capacity building, which was done in 3 phases. Training of 6 Sutra TOTs, 67 TOTs was also conducted from all our 8 sub-counties, and then end user training was also done in 2 phases. And in phase 1, we involved 192 healthcare workers who were trained. Phase 2, 167 healthcare workers who were trained, and a total of 422 healthcare workers were trained on Taifa Care Tibabu. And devices have also been received, and the department has received 529 tablets, as I had said earlier, to support digitization. And in the initial phase, we piloted 17 health facilities, and the second phase, we are rolling out additional 80 facilities tomorrow, which is 1st October. We are launching 80 health facilities in the first phase, and the pilot facilities have so far registered positive feedback from its friendly users. For example, it has raised shark claims. We have now a strong accounting module, and we are able to maintain commodity stock controls and management, whereby we shall be able to know our stock outs, and it would really help us also to control pilferage of some of our commodities. And the workload of our healthcare workers would also be monitored, whereby we shall be knowing the number of patients who are attended to, even by our clinicians and doctors, including even the pharmacists. And we shall also be able to generate monthly reports whereby the current gaps are being addressed. And we shall also be going paperless, whereby we shall not be seeing patients working with papers from one service point to the other. And even the long time of waiting by the patients will be drastically reduced. So tomorrow first, members of the media, we want to inform you that we shall be transitioning from paper-based to digital health information management of all our, of about 80 healthcare facilities in our county. And we may be experiencing some of the delays during these transition times, and also the system downtimes. And we want to inform members of the public that you bear with us the situation, as the migration from paper to digital system would be rolled out in our 80 facilities. Financing, I want to say that so far, Migori County, we have done well, and we have registered so far 489,180 residents to SHA, and this is 43.8% of our target population. And we are determined to reach each and every household, so that the introduction of FIF would really help us improve our services, and also make members access the essential service needs which they may have in the health sector. And it would also help us purchase commodities, and it's also going to relieve us of some financial burden of medical bills, so that accessibility to healthcare by the citizens of Migori County would be achieved without undergoing financial stress. On human resource, since this government came to place, you know the challenges we initially had with the Public Service Board. We did the first recruitment last year in October, and as a department, we were able to recruit 85 personnel. And this year, we also did another recruitment through the Public Service Board. We were able to recruit 65 healthcare workers, and in total, we have recruited 150 healthcare workers. And as you are also aware, when we came to power, the governor found a healthcare force which was not motivated, and they were really low in their esteem because some had stayed for many years, even over 10 years, without getting promotion. And this year I want to say that through the governor, His Excellency Dr. Chilayako, we have been able to promote around 800 healthcare workers. And these promotions have been effected, and their welfare has been improved, and they are now highly motivated and doing what is required of them. The good working relationship which our governor have with the national government, our health facilities are going to be upgraded through housing partnership. The governor has lobbied the State Department of Housing, and they are committed to improve our health facilities in areas which will be hosting affordable housing projects. And there are areas which are targeted, and I want to say that these targeted areas are like in Rongo sub-county, where affordable housing would be made or done. There would be improvement of Rongo sub-county hospital. In Uriri sub-county, we shall have improvement of Uriri sub-county hospital. In Awendo sub-county, Awendo sub-county hospital will be improved. And even here at Migori Referral Hospital, where the housing, affordable housing would be built, there is an improvement which would be done here. And then we have Timaru sub-county hospital, Kigonga sub-county hospital, Tisinye sub-county hospital, Keancha sub-county hospital, and even Bugumbe sub-county hospital. As we collaborate with the national government, His Excellency the Governor has good partnership with our partners. And as you remember, members of the media, just some 3 weeks ago, we launched Awendo Mother and Child Complex, which was built through the courtesy of M-Pesa Foundation in collaboration with the county government of Migori. And the department has already equipped this complex, also with the support of Luala Community Alliance, who also donated to us some equipment to enhance service delivery in that complex. And a similar project is also envisioned to be done in Kehancha and also Nyamaraga Sub-County Hospital. And these ones are being done through the lobbying by our governor, His Excellency Dr. Chilo Ayako. And we want to continue thanking Luala Community Alliance. With their support, they were able to donate 15.6 million to our county, which was used to buy commodities in level 2 and 3 facilities, which I had mentioned earlier. So the governor is also partnering with the Ministry of Health, the private sector, and all our partners, so that there can be healthcare transformation, not only here in MCRH, but across the entire county. If you go to Kegonga in Korea East, through the partnership we have with the national government, there is a modern complex which is being built by the national government, and this is courtesy of His Excellency Dr. Chilaya.
Currently, we are undertaking a fistula campaign here at the County Referral Hospital. It started on 26th, and the campaign will go on up until 10th of October. And we are urging all our women folk out there to go for screening in all our sub-county hospitals. And if they are found to be challenged with fistula, we'll be able to manage them free of charge. For the last 2 days, we have had a total of 11 procedures to restore dignity to our women, and we hope to do quite a number by the end of that period. Thank you. Okay, and ultimately we'll have a formal launch with the governor and his distinguished guests for that campaign on 7th of this month of October, and we welcome you all. But the screening services will be a continuous exercise, not just a campaign that will end, but will be a continuous exercise that will undertake in all our primary healthcare facilities as well as sub-county hospitals.
We normally take care of primary healthcare, and we are taking services to the people by doing outreaches. Every month we've made it, we are making it a habit that we go to every sub-county once. So this month, we went to Nyachike. We had a very big outreach that was very successful. So this coming month, October, we want to go to Awendo. And this one will be a very, very big outreach because His Excellency, the Governor, is bringing to us the CS Health, Mr. Duale, who will grace the occasion. So it will be very big. And then after the next month, we shall have another one in Uriri in November. So every month we shall be taking outreaches to the people so that people can get the disadvantaged, can get treatment at that point. And remember, when we go for outreaches, we do it freely, free treatment, but we are encouraging registration of SHA to continue. Please let us continue registering. We are only at about 43.8%. So we want the remaining population to register so that we can be fully registered in SHA.